My name is Chris Lavoie. My wife is Lourdes Cologne. And some time ago, we started seeing some things with Lourdes' health that were cause for concern. It started simply enough with a growth underneath her armpit, and they biopsied it, and we were worried, and the results came back, it's not breast cancer, and we were like, oh, that's fantastic, and we kind of moved on. And this happened a couple times where another mysterious growth would occur, and we'd be like, okay, that's not good. And then they do a needle biopsy on that, and they'd say, oh, it's not cancer, you're good. And I don't know, it just got to a point where we were just like, okay, you just get these growths, you don't have cancer, you know. And it turns out that they were looking for the wrong cancer, and the needle biopsy is not 100%, and in fact, it's not a very good test at all. For Hodgkin's lymphoma, it won't show up anything. And it wasn't until she finally got a mass on her neck, between her neck and her shoulder, that they finally cut into it and took a piece of it, and then they biopsied that, and that's how we found out that she wound up with Hodgkin's lymphoma. And I remember being at work when she got the results, and we were kind of nervous because this one was being treated differently by the physicians. It wasn't being treated like, don't worry about it, go home. It was more like, we'll let you know what we can plan for them. You know, that was the conversation. And when I got the call, I went into the warehouse, and she said, I've got Hodgkin's lymphoma, and I broke down and cried. But on the phone, I said, good, we know what it is. You know, I was really strong. And I said, we're just going to completely knock this out. And right then and there on the phone, Lourdes said, I'm not doing radiation or chemotherapy. And if you know my wife, you know that you don't argue with her when it comes to things like that. And between the two of us, I'm the skeptic between the two of us. You know, I'm always like, well, let's look at all the options, and let's see what's going on. And she's spent a lifetime convincing me of things before I'll sign off on it. And we did the research, and she took responsibility for it. She said, well, let me figure out what this is and what's causing it, and what we can do about it. And she explored all of her options. And there are actually an overwhelming amount of options available for someone who has cancer. The doctors in the United States, they parrot, they have this routine where they go on about, this is the most curable type of cancer that you can have. If you do chemotherapy and radiation, you'll see results in months. You don't have to lose your hair. It's really like, we talked to 3 oncologists, and they all said the same thing, basically. We need to do chemo, we need to do radiation. And we know people firsthand. Lourdes went so far as to meet people. Like, she found them on the internet, and she had conversations with them. And they, for example, one, Sharon Winters, cured herself naturally. She worked with a chiropractor and fixed herself nutrition. And she had 3 different types of cancer, and she was terminal. And you know, I've spoken with her too. She's a sweet lady. And the thing about that is that the skeptic, myself, I was starting to come around to this thought process. And Lourdes took on the nutritional aspect of things. Cut out sugar. You know, we didn't realize sugar was so detrimental to someone with cancer. And you have to find that out yourself, because her doctor recommended she eat ice cream and junk food. And you know, get your weight up, because chemotherapy is going to knock you down. And between chemotherapy treatments, eat a bunch of junk food to keep yourself, you know, Twinkies. And like, I'm not kidding. This is the advice we're getting. And there's also, if you look for it, there's a network of amazing people who will guide you to the right solution for yourself. And that's how we wound up here. You know, we didn't know about this place. We didn't know it existed. And it was through a friend of a friend who Lourdes had met, and then he said, try this option, and we met with Dr.John. I think the thing that was amazing to me is we met Dr.John in Dr.John's house. You know, it wasn't like, you know, let's go to another hospital and sit down and have this clinical environment. We were in his home, you know. And what amazed me also was how much knowledge was coming out of it. It wasn't just, a lot of doctors want to say, well, let's run a bunch of tests to see what we can figure out. And Dr. John was assertive. He said, no, I can tell by looking at you. You've definitely got Hodgkin's lymphoma. We don't have to do any tests to know that that's the truth. I can tell you're in advanced stages of it. You know, I can see it in you because I've dealt with this and I know what that looks like. I don't have to do a PET CAT scan, which causes growth in my wife because of the sugar and the radiation. Everything that was said was things that we had either researched and knew to be true, or just really made a lot of sense. You know, so when we walked out of there, there was a sense of, okay, this guy knows what he's talking about. It's not, you know, it's not snake oil. You know, and again, here's my skeptic. You know, it's not snake oil, so he must be on it. He knows what he's talking about, and
it was very detailed.
It was very detailed, absolutely. Yeah. And even from there, within the home, there were things that he had that he gave you right away.
Yeah.
He said, drink ASEA, and here, these, I don't know how much they are a bottle, but they're not, you know, they're not $1.99 at the 7-Eleven. They're a processed type of water. And bought us a case of it, and wanted to get you going right away on something. You know, he didn't want you to leave without having something in your system to start combating this.
He gave it to us right there.
Yeah, that's true.
Right here. Yeah.
I remember he made you drink as you were sitting talking to it. So when we got here, I was actually scared from the first day, and the first encounter we had was with Dr. Diaz, and I think Dr. Diaz could tell that I was scared. Lourdes, she had never looked so pale, and her eyes were dark, like, you know, like a raccoon's eyes, and that was new, and she couldn't breathe without coughing, and she was so very swollen. Just sitting up was an act of will on her part. She just physically couldn't do it. And Dr. Diaz took me out of the room, and he said, listen, this is as much mental as it is anything else. You can't be upset about this. She's going to be fine. She's in the right place. She's in the right hands. You need to be positive. You need to really see this for what it is. And I was kind of surprised, because this is the first time a doctor had taken me and said, listen, there's a mental aspect of this that you have to know is there. And it's, you know, the most important part is the mental aspect of it. It's, you know, we'll take care of the body, but you got to keep your spirits up, and you got to keep her spirits up, and you have to be strong. And like instantly, I felt at ease about being here, because it's what I believe. It's what we believe is that, you know, the spirit and the mind have a great deal to do with what's going on physically, and it was just what I needed to hear at the time. You know, and so from day one, she started treatments. You know, instantly, yeah. Like, here you go, you've just arrived. Here's the first treatment. You know, it was like within 5 minutes, she already had an IV set up where she could start receiving some of the treatments. And I don't pretend to understand most of the treatments, you know, but I'm content to know that I don't have to, because when I can't see. We joked around and called it her pearl necklace, because there was a string of nodes you could actually see. When I can't see that anymore, I don't even know why it worked. It just worked, you know. When the really stubborn tumors that have been there from the beginning are now escaping and evacuating and leaving her body, retreating, you know, I don't need to know why it worked. It just works, and it's explained to me. And I get it at the time, but all I hear is, "Hey, it's working." You know, it's like, this is doing this and that, and this is causing this, and it's like, okay, I heard you say it's working, so that's where I am with that. So we're seeing dramatic results, just
even the lines,
amazing results.
When he let you hear.
Oh, sure.
Remember?
And for the first time, I was given a stethoscope and said, "This is what we're listening to. You hear it." And I said, "Actually, I do. I know exactly what you're talking about." And I heard it before and an after, and I've never been so much involved with what it is. I've always been a spectator, you know. But they brought me in. The hospital brought me into it and said, "This is your thing as well," you know. So,
which is nice.
Yeah, we've been real partners with it then.
Well, and it's kind of cool because it was like he got to hear when you couldn't hear anything when I breathed in the one lung, and then when they drained everything and he could hear the lung expanding. It was, so I thought, really? So that first time you can hear anything? It was like, no. I was like, wow. So that was
Yeah.
way cool.
What are you going to do once Lourdes gets healthy?
Yeah, no, it's a good question because we're actually working on a documentary about her journey, and people need to know that there are options available to them. And I'm not a conspiracy theorist per se, but you know, there seems to be a conspiracy when every doctor you go to fails to mention, oh, by the way, there's this facility in Mexico that can treat your cancer without using any sort of harmful chemicals. You know, and you have to think they know about it. It's their profession. So we've already started touching other lives with it because Lourdes has had people who are saying, my cousin has cancer. Can you talk to her?
And one of my friends, I told her, I said, I'm at this hospital. And I gave her the name, the website, everything. I said, you got to check it out. I said, this place is the place if you want to get cured. I mean, it's really, I told her, I said, if you could have seen me before, you know, because she didn't get to see me when I got really bad. So she took all the information, and she's one to share as well. And actually, the lady that wrote Outsmart Your Cancer actually said, when you go to this place and you're better, can I put that in my website and in my story? I said, absolutely. I said, everyone should know about this place. So.
Well, I guess the short answer is I mentioned that there was a network of people that's available to you if you look for it. The short answer is I plug myself into that network. You know, I become a part of that network. So far, I've not met anybody ever who hasn't been affected somehow or another with cancer. Everybody has a relative, or they themselves, or you know, there's not even 6 degrees of Kevin Bacon. You know, that game that you can play. It's literally everybody knows somebody. You know, and just actively being a part of that network. I've been writing about it online so people can follow what's going on with us. I plan to continue to do so. You know.
Oh, everybody knows about this.
Yeah.
We put it like everywhere. We put it all over our Facebook, and I have like 2,000 something friends. So and people have been going into it, reading about the place and all the results I'm getting. So we've been really plastering it.